Ladies and gentlemen, the Minister of Health, Dr. Christopher Tufton.
I think we can all conclude that Prof. Henry had one too many cubes of sugar in his coffee this morning. But he means well, and so we'll forgive him. Distinguished ladies and gentlemen, beginning of course with the chairman, Professor Fitzroy Henry, College of Health Sciences, University of Technology. My colleague who left, Minister Shaw, who basically gave my speech, so it's repetition after this, but it's good to repeat sometimes. Professor Stephen Vassiani, an old friend and colleague of mine, President, University of Technology. All the specially invited guests who are here from outside of Jamaica, who are visiting with us, who are going to be participating in this event, we welcome you. Faculty members of the University of Technology, staff members of the Ministry of Health, members of the media, distinguished ladies and gentlemen. This is a great gathering. We have a full house, and there are so many different organizations being represented here. Heart Foundation, the Cancer Society, so many. I want to just recognize all of you and really play my little part in saying to UTech, Professor Henry and his team, congratulations on a well-organized event, clearly from the turnout here, and certainly based on the agenda of important discussion that will take place to advance this cause of public health. You know, I am also very pleased, and I'm deviating a bit, but forgive me. Yesterday I was at the University of the West Indies launching the mosquito research unit. It's a unit that we've been working on over the past year, essentially to develop a scientific research-based approach to understanding that particular vector, which has caused us significant challenges, and in understanding, attempt to control the population. And that collaboration is now a reality. And I was really pleased to be a part of influencing that arrangement. Today we're here with UTech, and I just want to make the point that it is so important for us in public policy to ensure that we get the best and to get the partnerships that are necessary in order to advance the cause of good governance. And I want to really recognize both UWI and UTech for working with public health to attempt to deal with the challenges that we face in an applied scientific way. So we're here, and Prof. Henry outlined how we have gotten to this point. And today, again, marks another milestone in our attempts to collaborate and to advance this important cause. For several decades, non-communicable diseases, NCDs, were the leading cause of morbidity and mortality in Jamaica. And it is true that people must die from something, but the concern here is that most of these diseases are preventable, which means that many die prematurely. But what is even more striking is that in recent years, younger and younger Jamaicans are succumbing to these diseases. And this for us is clearly alarming, not only because it imposes heavy cost over a longer period on the public health system, but also because it represents an enormous human loss and reduces the overall productivity by the premature death and or disability of people during their most productive years. The good news is that we can prevent most of the obesity and NCDs because we know that diet and physical inactivity are major contributory factors. The ministry's launch, as was said earlier, of the Jamaica Moves program and the National Food Task Force, which Professor Henry chairs, are two of the several initiatives designed to halt the increase in obesity and its consequences. The task force is focusing or has focused on a few things. Firstly, product reformulation, food labeling, marketing of foods to children, nutrition education, promotion, and advocacy, which includes, as we're discussing today, the possibility of fiscal measures. The World Health Organization is very concerned, as we are, about the obesity crisis, and they have published guidelines that individuals should consume no more than 10% of total calories from added sugar, and preferably less than 5%. The concerns stems from the fact that globally, obesity rates have doubled in the last 30 years. In the Caribbean, surveys show as much as 78% of some populations can carry unhealthy weights. In Jamaica, obesity rates are increasing by an alarming 1% each year. This trend is astounding and clearly calls for bold and sustained corrective action. 10 years ago, the estimated annual cost for diabetes and hypertension alone in Jamaica was estimated at some 5.9% of GDP. Frighteningly, recent national surveys have indicated an increase in these numbers to some 9.7% for diabetes and some 20.6% for hypertension. This means that left unchecked, obesity and its consequences will not only retard health and economic development, but importantly also erode the health advances made in over the last decade. Obesity is never seen as a death certificate. We see instead heart disease, stroke, diabetes, cancer, hypertension. But there is little doubt that these are predicated on obesity, which is the most important underlying cause of death in Jamaica. For this reason, the Ministry of Health has developed a critically important, multifaceted strategy to combat obesity, particularly childhood obesity. The ministry is aggressively trying to get all stakeholders to recognize some bewildering facts about obesity, and I'm going to outline a few of them. Firstly, the risk of adult obesity is several times greater in obese children than those non-obese. In addition to having a high chance of becoming obese adults, overweight children also have an increased risk of later cardiometabolic morbidity and premature mortality. An increase in the number of years spent in an obese state increases the risks of NCDs, emphasizing the increased benefits of targeting the prevention of obesity in the younger population. Targeting the prevention of obesity in children may be far less expensive than having to treat the consequences of obesity later. As we say, prevention is always better than cure. The spiral continues because children of overweight and obese parents are more likely to be overweight and obese themselves. The epidemiologic shift of obesity to younger ages has significant ramifications for children's physical and psychological health, the health of future generations, and the sustainability of healthcare system. And therefore, bold, creative, and sustained policies are required if Jamaica is to strengthen children's learning potential and decrease the risk of nutrition-related chronic diseases later on in life. It's as simple as that. The diet of the population is central to the development of obesity and its consequences. The major contributors to obesity are excess calories from sugar and fats. Fast foods are known to be loaded with fats, and attempts to reduce their consumption or alter their composition to more healthier options are clearly justified. The fact, however, is that less than 20% of all Jamaicans consume fast foods more than once per week. In stark contrast, more than 75% of Jamaicans consume more than one sugar-sweetened beverage every day. Other sugary foods such as buns, ice cream, cereals, and chocolates are frequently consumed in Jamaica also, and we recognize that reality. These sugary foods are clearly also important for targeting. Now, questions are often raised about why focus on sugary sweetened beverages, at least in the first instance, because it's a more holistic approach that will seek to look at moderation across the board. But the target and focus here today is because of several reasons. Sugary sweetened beverages makes the largest contribution to sugar intake based on all the studies that we have seen. More Jamaicans consume sugary sweetened beverages than they do other similar products in terms of nutritional content. The evidence for a link between sugar sweetened beverage consumption and childhood obesity is consistent and it is compelling. The connection is there, the connectivity. Conversely, reducing consumption of sugary sweetened beverages has been shown to reduce weight gain in children, particularly those who are already overweight. When more sugar than needed is consumed, and I'm being a doctor here, a real doctor now, not the other doctor, the liver converts the excess into fat, some of which is stored around the body. Repeatedly consuming too much sugary sweetened beverage will lead to weight gain and obesity, and an increased risk of diabetes, heart disease, and liver disease. Sugary drinks are particularly harmful to the body in liquid form. Sugar in liquid form is absorbed more quickly by the liver than the liver might be able to process. In Jamaica, the sale of some soft drinks increased by more than 40% each year between 2014 and 2016. We would like to see those companies profit more by higher increased sales of water and low sugary drink. Sugary drinks are targeted not only because they have very high sugar content, but often little or no nutritional benefit. The World Health Organization has also expressed concern, as said earlier, that the increasing intake of the free sugars, particularly in the form of sugary sweetened beverages, increase overall energy intake and may reduce the intake of foods containing more nutritional adequate calories. So ladies and gentlemen, this symposium, which focuses on sugar sweetened beverages, is therefore a landmark event for us. And I wish, as I said earlier, to congratulate the University of Technology, Jamaica, for organizing it. I note that all the topics to be presented are highly relevant and, as far as I am concerned, critical, both in providing information, but in making that case as part of the advocacy that is necessary in order to correct what clearly is a crisis that we face. There is no doubt that these perspectives will be crucial to decision makers across the Caribbean and elsewhere. I'm also pleased to learn that the proceedings of this symposium will be published soon after, so that a permanent record of it will also be available. Because sugar consumption in the form of sugary drinks is increasingly global, this is why more and more countries are implementing various measures to tackle it. And you've heard of some of the measures from the earlier speakers. The WHO, the World Health Organization, we're a member of, has urged member states to develop guidelines, recommendations, or policy measures to reduce the content of sugars in food. In Jamaica, we are answering that call, and this symposium is a forum through which several measures will be proposed. We do recognize from consumer research that food cost is the single most important factor influencing food purchasing decisions. Accordingly, the action plans in the Ministry of Health for Obesity and NCDs aim to, and I am quoting, promote taxes and subsidies to improve the affordability of healthier food products and discourage the consumption of less healthy options, unquote. This strategy is also justified because research has shown positive associations between consumption of added sugars and weight gain. In addition, the consumption of sweetened beverages, sugary sweetened beverages, is strongly associated, as said earlier, with cardiovascular disease. In the last 5 years, several countries around the world have introduced a tax on sugary drinks, but few have carefully analyzed the implications of such an approach. And I think this symposium aims to do just that. But while the imposition of taxes on less healthy products can prevent serious damage to the population's health, it is important to note that the position of the Ministry of Health is that these fiscal approaches must be supported by the other activities in the action plan towards the consumption of a healthy diet. Any policy strategy to impact the consumption of sugars and sweeteners must therefore ensure that consumption of other risk ingredients will not increase as a result, but instead healthy options such as water, root crops, fruits, and vegetables will become the food items of choice. The Ministry of Health will continue to emphasize the importance of a comprehensive approach to effectively tackle obesity and NCDs, and debunk the notion that one intervention alone, which is applying a tax, is the only intervention that will have impact. In other words, we're taking a holistic approach, and I don't want anyone to feel as if we're beating up on them, and I'm referring specifically to the manufacturers or distributors of sugary sweetened beverage. This is part of a process. We believe that we have an obligation, in the first instance, to provide information. Beyond that, to respond to the crisis that is clear and present by creating a regulatory framework for the benefit of our population. To ignore that reality would be to ignore our fiduciary responsibility. As a consequence, this gathering is appropriate, it is relevant, and it will advance the cause that is in keeping with the mandate of the Ministry of Health. I wish you luck and best wishes during the course of the day, and I declare officially the symposium open. Thank you.